So the question is, let's just say you have a DVT. Let's say you have a clot in your legs. Let's say it's not completely resolved. We don't completely break it down. What is a long-term impact of having that? Of having a clot just sitting there?
I mean, it could move elsewhere, right?
So that's the concern in a more acute setting, meaning in a more immediate concern is absolutely. That clot, if it's very loose, new clot, it can fly up into your chest, cause a pulmonary embolus, which could obviously kill you. Now, what if that clot, over time, clots harden up? So it becomes much less likely to fly up into your chest. So what tends to happen is it just gets more and more adherent to the wall. It gets to be a harder clot. So what that means is now your vessels are smaller. Your veins don't have that. You're not able to push the blood back centrally. So what is the problem that people can have going forward? And so the answer to that is something called Post-Thrombotic Syndrome. Okay, so we see this quite a bit. We see it all the time in patients. It happens about anywhere from 20 to almost 50% of patients who've had DVT that is unresolved.
A lot.
Exactly. So it's a large number of people who have this. So what do you see in the legs? So you see persistent pain, aching that doesn't go away, swelling. Long-term, we just see a lot of edema, which is just fluid buildup in your legs.
You see bruising?
Exactly. So you do see skin changes.
I have those symptoms.
Exactly. You see skin changes. You see tingling, redness. The classic thing you see is brownish skin discoloration. And so your skin might even feel a little bit thickened, hardened.
Yeah.
And worst case, sometimes we start seeing patients develop venous ulcers or sores, which tend to occur on the inside of your ankle. So if you feel that little bump on the inside, that's kind of an area where I typically see vein-related ulcers. Now, why is that? Because as I said, the blood that's pumped to your feet is not able to get pushed back into your chest, and all this blood now starts leaking out. So it's leaking out from your veins because this chronic hard clot that's been sitting there, it's not able to get past it, and it just gets pushed out. So that's why you have these skin changes. All of a sudden, that redness that you see in your skin is because the blood that's inside your vessels gets pushed into the outside, into that muscles, all those other tissues that's surrounding your blood vessels, and you're seeing that swelling.